Okay, I will call a June 1st, 2022 Winnebago County Mental Health Board meeting to order. And roll call as follows. Dick Cooner.
Present.
Dr. Copeland.
Present.
Dr. Bill Gorski.
Present.
Dr. Giardini.
Present.
Tim Neighbors. Linda Sandquist. Here. Wendy Larson Bennett.
Present.
And our advisory member, Jeanette Towns, is attending virtually. Thank you. Also, I want to welcome Jason Holcomb and Chelsea, staff from Region 1 Planning Council. And we will move on to, we do not have public comment today. We have no presentations today. We did have included in our packet the monthly activity report. Jason, is there anything you want to highlight from that report?
I'll just say that May was a very busy month. It was Mental Health Awareness Month, so we were asked to participate in many community conversations, presentations, mental health expo as well. And all of those went very well. The reception that we're getting from the public, especially as we start to demonstrate outcomes and be able to transparently report what some of those outcomes are, we've gotten really great feedback. Not just so much on what the outcomes are, but the fact that we're even tracking outcomes, I think is getting very good feedback from people. And so I'm just happy to mention that Chelsea did a wonderful job. I don't know if you're on Facebook and you follow along the Mental Health Board Facebook page, she did a social media campaign in May, which highlighted programs from the first year of funding with some of their outcomes. And that was, there was a lot of engagement with that. A lot of people sharing those posts, including Winnebago County government yesterday shared and thanked us actually for doing that campaign. And then lastly, Kristen's not with us, but she has been very hard at work also getting all of our funded programs up and running for another program year. And we've done 17 follow-up meetings already since we made those award decisions at the last meeting to get these programs, get their funding agreements signed, work plans signed, any budget changes that are needed to get those modified and get them moving forward.
Well, thank you, and I want to personally thank you and Chelsea and Kristen for just excellent work. We do know the amount of work, and we certainly are appreciative. We feel fortunate to have all of you. Thanks.
Thank you.
Okay, moving into the action items. First of all, I will need a motion for approval of the May 2022 meeting minutes.
Second.
Okay, Wendy made the motion, Dick Cooner seconded. Any discussion? Hearing none, all those in favor, please say aye.
Aye.
Okay, and moving into the election of officers. At this point, the one thing that I will do prior to us beginning this is to inform you that with the Robert rules, that if we only have one person nominated for a specific office, our bylaws do not require that a ballot vote be taken. I, as the chair, will proclaim the one person, if there are only one for the particular office, as election by unanimous consent. So it'll just, obviously, if it's only one person, that person is. So I'm opening it up. The nominations are now in order for the office of president.
I nominate Marion. Second.
We don't even need seconds. We
You know,
do not.
Marion, we're following some kind of law. Is that what we're doing here?
Robert's rules of order.
Robert rules.
Mhm.
I think we had talked this last year that, why don't you take a 4-year term and then we could talk about it. I mean, if we do this
No,
every
we have
year.
to elect officers prior
Well,
to.
Robert isn't here.
The public, yes.
Yeah.
And the bylaws are.
So
And the bylaw
terms are
I'm sorry,
actually
but
set by-
no, actually, that's not true.
Oh, they are.
Yeah,
Too
the
many.
annual election of officers, that's actually dictated by the Community Mental Health Act.
as well. Oh, yes, it is.
So Robert doesn't get a say in that.
But I'm sure he's dead.
Mary Ann Abadi is nominated. Are there any for the office of the president? Are there any further nominations? Hearing none, the nominee of Mary Ann Abadi for office of president is elected by unanimous consent. Moving on, nominations are now in order for the office of the vice president.
Good Cooner.
I'll second.
No second.
You don't.
For emphasis.
Okay. Richard Cooner is nominated for the office of the vice president. Are there any further nominations? Hearing none. Thus, affecting the election by unanimous consent. The nominee of Dick Cooner for the office of vice president is elected by unanimous consent. Moving on to the office of the of the secretary. I need a nomination from the floor.
Who's currently?
Bill. Ooh. Bill.
Okay,
You didn't even know.
That's
a good thing. That's a good thing.
Dr. Bill Gorski has been nominated for the office of secretary. Are there any further nominations? Hearing none, the nominee of Bill Gorski for office of secretary is elected by unanimous consent. And the office of treasurer the nominations are now in order for office of.
He's sitting next to me.
I nominate Wendy Larson Bennett.
Okay. So Wendy Larson Bennett is nominated for office of treasurer. Are there any further nominations? Okay. The nominee of Wendy Larson Bennett for office of treasurer is elected by unanimous consent. So we have completed our nominations and our elections.
Madam President, may I make a statement just in answer? It's not that the treasurer is onersome or anything like that, but just as a matter of practice, I think it's good just to have a different treasurer every now and then. And I'm trying to focus my attention on doing some things in the community as it relates to mental health. And I feel that I'd just be better served having somebody else do that. Sorry.
Yeah, I know that you
Thank
have
you.
a lot
Thank
of
you.
irons in the fire.
Thank you
I
for
just
what
want to
you've
make
done.
this conditional, that when I call you, you're gonna call me back. Okay?
No problem.
All right?
No problem
Okay, moving on to discussion items.
Just for note, for those watching, for transparency, those positions will become effective July 1st and be for the term of 12 months.
Right, because this cycle was only 9 months.
Due to the original bylaws dictating that the officer cycle was on the fiscal year cycle, they were from October to September, and then when the legislation went through that connected the mental health board statutorily to the Community Mental Health Act, the Community Mental Health Act dictated that it be a term from July 1st through June. And so that's why there is the change this year. And so this was the only time where there's a 9-month term to create now alignment with the Community Mental Health Act.
Okay. Moving on to other matters, I just want to bring to your attention that our next monthly meeting would actually be the week of July 4th. And I know some of us are traveling, and if need be, if enough people inform Jason that they're not going to be available, we would have to move the meeting back a week in July. So and we do not need, an action item for that to occur or vote. But it would just so that we'd have a quorum and be able to conduct a meeting in July because we do have some work works,
Yeah.
plan amendments.
So we have to go
approve.
back to June 29.
No, July
You mean July 12th, or
Oh.
13th,
13th, yes.
4th is a little bit.
We have another, the only thing that we're anticipating for a potential action item in July that is time sensitive is that there are a number of organizations that require budget changes due to receiving partial funding or due to their special conditions. And so we were hopeful that we could put those on the July meeting ballot. That way people can get their programs up and running and not delay that another month
Right.
while they're waiting for budget adjustments. So that's the one thing that we anticipate could happen in July, that there would be the need for a meeting, because those budget changes do require board approval to become official. So I've held this meeting room for the second week of July, should that be a more available date for.
Second week, was that the 13th, you said, is that?
Yes.
Yeah, I won't be here. I'll be in Carolinas. I won't be here either on the 13th either.
Yeah, I'm gone the 13th.
Wow.
I'm sorry.
That might not solve a problem then.
Yeah.
But maybe July, the week of, the first week in July would be better.
What's the 6th?
We can keep it to our regular meeting cadence.
Okay. All right. And the last item on the agenda is Dick's, always,
Sure.
I need a motion for.
Need a motion to adjourn. Well, I so move.
I so second. We're there.
All
Are
those
you
in
kidding
favor?
me?
Yeah.
That's a record.
Yeah.
Yeah.
That's
All
an
right.
official chairman.
Well, no, it's the fact that we only met today for the purpose of electing officers. And that was mandated, so.
Are we doing a thing over at Memorial Hall again for the distribution of funds again, Jason, like we did last year?
Well, last year we did something after all the funding agreements were signed, so with more programs this year, I'm not sure that the timeline will be the same,
Okay.
but we do want to, of course, do something for the community to hear about all the new programs
Okay.
once they are awarded.
Just
Did
curious.
everybody like the format of it at the,
I thought it went really well.
because I mean, it's probably easier for us to do what we've already done than to do something new, so if that was something everybody enjoyed.
I do.
And,
I did
and it
too.
was nice to have, there's space for the community to be present, and maybe with COVID restrictions theoretically at least lessening, maybe we could have more community involvement. It was nice.
Did we take a vote on the meeting adjournment? Or did you just get a
We
first and
did,
second?
we
But-
did, yeah, we did do a vote for closing the meeting.
Well, that's okay, because we're still discussing.
Yeah, so,
I think every opportunity that we have to connect the community to the work that's going on and help keep it in the public. I want to acknowledge, how many of you saw Jeanette on the news in the last, how long ago was it, Jeanette, about 2 weeks ago?
It might have been a week ago Thursday.
A week ago. Jeanette was interviewed, and she did a lovely job talking about her lived experience. And maybe you could tell us a little bit about what you're doing, because I think it's important.
What I'm doing with my life,
Yeah.
finishing up my second book. I am involved with a mental health ministry at a local church as like a facilitator. I am a part of NAMI's Faith Net, where I go into churches and tell my story. I'm doing a lot of stuff. I'm doing seminars online. All kinds of stuff. I've been really busy.
This woman is a force of nature, in my opinion. But her generosity of spirit in offering her lived experience to the community, and I think is powerful and important for us to acknowledge.
Without a doubt.
Thank you, Wendy.
Okay. Anyhow, for the adjournment, we had the motion to adjourn with the second. And I think I put this vote already, but I'll do it again because you did not. All those in favor, please say aye.
Aye.
Oh, same sign.
Okay. Well, short and sweet, gotta like that.
No, no